I would like to introduce you to World Medical Education, a new not-for-profit social enterprise delivering open access multimedia education to health workers worldwide. Our platform allows the development of video-intense multimedia educational programs for all levels of health workers, from community health workers to doctors and nurses. We have also developed systems that allow delivery of these programs and uniquely continuing video-based education to health workers worldwide, even those working in the remotest locations in the poorest of countries. It is accepted internationally that if we are to reduce the huge numbers of needless deaths and suffering of children and adults, access to well-trained health workers is essential. The aim of the World Health Organization to achieve universal healthcare by 2030 will not be realized without a transformation of our approach to the education of health workers, particularly in resource-poor countries. The World Health Organization projects there will be a shortfall of 18 million health workers that are needed if the aim of universal healthcare is to be achieved by 2030. However, the situation is not as simple as this. Even if we train enough health workers, few will have access to meaningful continuing medical education that is essential to maintain their clinical skills. It is known that if we teach one health worker well, many will benefit. Our approach will give us the opportunity to teach tens of thousands and more, and provide them with meaningful continuing education, so they will benefit the lives of millions of children and adults worldwide. Research also predicts that such an approach will also be highly cost-effective for countries, as educational programs can be adapted and shared worldwide. It is time for society to demand that all health workers, irrespective of where they work, should have access to state-of-the-art training. They should have access to reference materials that cover the spectrum of illnesses they are presented with, so they can refer to these when seeing patients. This is essential. They should also have access to meaningful continuing medical education and have their skills assessed on a regular basis to help tailor the education they require. We believe our approach will help to achieve this by using video-based, multimedia training programs that use clinical videos of patients, their treatments, and of clinical procedures. Our approach will also help to solve the problem of access to state-of-the-art training, continuing education, and assessment of health workers. I am now showing the website for World Medical Education. I won't go through this in any detail, as you can go through it at any stage. I'm going to go straight to the learning platform. This is a platform that we have developed over many years, and we have donated all of the intellectual property associated with it into the not-for-profit social enterprise World Medical Education. The platform is very powerful. It allows you to develop context-specific video-intense multimedia courses in any area of medicine and surgery. It also allows tracking of students and assessments of students. We've completed a few courses now, so have real proof of concept. For example, we have finished one on eye disease, Ophthalmology for Africa, that trains eye health workers in Africa, medical officers, nurses, medical students and junior doctors on eye disease. As you can see from the index, it is very detailed, going through everything they need to know, ranging from clinical cases and identifying eye disease, through to practical procedures. If I just click on one of these, you can see the video playing, and if I click on this button, a transcript appears that can be translated into any language, or you can put subtitles in.
Examining the conjunctiva and sclera. Now go up even closer with the torch to examine the conjunctiva and sclera. Gently lift the upper lid, and then pull down the lower lid so you can see the conjunctiva and sclera. You may see redness or foreign bodies. You may see a lump on the conjunctiva. A squamous cell carcinoma of the conjunctiva will look raised and irregular. It may have abnormal blood vessels supplying it. These are often linked to HIV infection and must be removed urgently and carefully.
I'll just stop it there. This program contains at least 300 videos and in many cases will give health workers experience that they may take years to gain. Indeed, if it was not for the ability to see these video cases, they may have never seen the condition they are presented with in practice. You have seen how we can develop programs and distribute them via the internet. However, vast numbers of health workers in remote areas cannot access the internet. We have therefore designed an innovative system that allows multiple video-based multimedia programs to be stored on the memory stick or downloaded onto the mobile phone. Our app on the mobile phone allows you to navigate through the programs. This approach allows health workers in the remotest areas access to multiple programs that they can learn from and refer to when seeing patients. But the real innovation is that we can provide video-based continuing education in the absence of the internet and also assessment of health workers in remote locations, again without the need for internet access. This approach can also be used to provide pragmatic, explanatory videos that can be shown to patients and families. Multiple programs can be uploaded onto the mobile phone, and you can see me navigating through this at the moment. You can click on any module you want wherever you are, and you can see it just before seeing a patient, or just to refresh your memory at any stage.
Follow up the child.
The child will need...
After you've watched it, you can navigate back, and if you want to, you can upload as many documents as you want on the document library, so you can use these at any stage as reference materials also. You can click on this button, which is the Continuing Medical Education button, and you can be delivered video-based continuing education without the need for internet access. It is so simple to use. I'm showing you the database on the left and a mirror image of my phone on the right. This is just a demo version. However, the database can be made up of registration details of all of the health workers in a country, and you can sit at your desk in the Ministry of Health and send an SMS message to unlock continuing medical education stored on the phones of all of your health workers at the same time. This will allow you to deliver meaningful continuing education once a week or once a day. Let me show you how the system works when a message is sent to just one person. If I click on this health worker, I can send an SMS message with a code that unlocks their continuing medical education video stored on their phone or memory stick. The message is sent, and you can see it has been received by the phone. To unlock the continuing education, the health worker types in the code. This allows the user to view a video on a specific topic they have not seen before. The first time they see the video, there is no explanation associated with it. I'm scrolling through the video quickly, and as you can see, when it stops playing, the next screen comes up where the user can watch the video again or answer the questions. The questions aim to assess the user's clinical skills and management decisions. Yes, you should remove the ear stud. The infection is usually caused by Pseudomonas aeruginosa, something many health workers don't appreciate, and this is one of the main reasons patients develop severe ear deformity, in addition to failure to make an early referral to ENT experts. So the health worker has scored 4 out of 4 and then presses the Play Explanation Video button. This brings up the video that now has a full explanation of the problem, how to recognize it, how to manage it, and when to refer. Early cases show significant redness, as in this case, and you can see swelling of the ear. As you can see, the ear is very tender. As soon as a health worker presses the Play Explanation button, it also immediately sends their results to your central database, so you have assessed their knowledge before delivering their continuing education. Once the user has watched the video with a full explanation as many times as they want, they are asked to answer the same questions again, and their answers are sent back to your central database. So you have delivered their continuing education and assessed them before and after. There are many other ways this system can be used, for example, to help to respond to a cholera outbreak. Recognizing the signs of severe dehydration, seeing in the young malnourished child in the video and how best to manage their care would improve the outcome of so many. For example, if there was an outbreak of cholera in northern Somalia, you could send a code to all of your community health workers in that region that unlocks a video on their phone or tablet that shows a patient or patients with cholera that has no explanation. By asking questions relating to the video, you test the clinical skills and management decisions of the health workers relating to cholera. You immediately see their results on your database. They then get access to the educational video on cholera that contains a full explanation of how to recognize the clinical signs, how to manage and when to refer, and how to prevent. They then answer the questions again to see if they have understood your educational messages. So within hours, sitting at your desk in the Ministry of Health or elsewhere, you have assessed your health workers, even those working in the remotest of locations, provided essential continuing education, and determined if your educational message has been understood. This simple system has the potential of markedly improving the outcomes of children. It is essential that educational systems are future-proof and sustainable. All of the digital content produced by World Medical Education aligns to universal formats such as SCORM and MP4, and as such is future-proof against the inevitable changes in technology. Equally, the World Medical Education delivery platforms, the learning management system and applications are platform-agnostic native builds. As such, they can be easily modified and updated to benefit from new technologies and distribution mediums. This is in keeping with an established technology development protocol developed by Dr. Nicholas Blackwell, the Technology Director of World Medical Education, that has been successfully delivering multimedia education for the United Kingdom's National Health Service for more than 20 years. A major advantage of the learning management system is that it allows easy peer review and updating of programs. With appropriate support and within 5 years, we will have developed evidence-based education and continuing education for tens of thousands of health workers worldwide that we believe will lead to improved health outcomes for millions of children and adults. Benefits of this approach will be seen immediately and increase by orders of magnitude during the next 5 years. Health workers will immediately have access to programs World Medical Education has produced on eye disease in Africa, the WHO UNICEF training for community health workers across Africa on pneumonia, diarrhea and malaria, and an exceptional program on the management of minor injuries. Within months, we will start collecting and making peer-reviewed videos across a wide range of topics and make these available to health workers worldwide. We are working with Centres of Excellence to collect videos in the Philippines and UK and have agreed to start this in Uganda. Within the next year, we will adopt further centres in Asia and Africa. Our projects are ethically reviewed with the most detailed consenting procedures. Collection of videos in various clinical areas ranging from maternal and child health to non-communicable diseases will place us in a very strong position to develop bespoke multimedia training programs aimed at the different levels of health worker. A cornerstone to our approach is to ensure research is conducted to determine if programs produced improve clinical skills and management decisions of health workers, and where possible, their impact on clinical outcomes. Let me give you 3 examples of programs that we will develop. Deafness and hearing loss are major disabilities and so often ignored despite the profound effects on the lives of 350 million adults and children affected worldwide. The economic burden worldwide is also huge, estimated at $750 billion per year. Yet so many cases of deafness and hearing loss could be prevented and treated if all levels of health workers, ranging from community health workers and care assistants to doctors and nurses, had the training they needed. Sadly, education of health workers, particularly those working in resource-poor countries, is very poor in this area. The current World Health Organization training is paper-based and reaches so few. Instead of seeing real patients and clinical procedures, the paper-based resources just show simple line drawings. To help change this situation, World Medical Education is working with the University of Santo Tomas in Manila and the World Health Organization to develop a state-of-the-art video-based training program on deafness and hearing loss. Eye disease is a huge problem with 254 million children and adults visually impaired or blind. Current training available to health workers is mainly paper-based and reaches so few despite the fact that 75% of sight-limiting disease is preventable or treatable. We have already produced the video-based multimedia program Ophthalmology for Africa, filmed in Uganda and Tanzania, that provides context-specific state-of-the-art training for eye health workers, nurses, medical students and junior doctors. This program has been subjected to a randomized controlled trial in Uganda, showing its use significantly improved clinical skills and management decisions, providing evidence of its effectiveness. Here you can see it being used on our app mobile phone system. As you can see, the interface is intuitive and very easy to use, simply by clicking through the various topics.
Objective 2. Objective 2. Explain the need for prompt irrigation after chemical injuries. It is important to work very quickly, particularly if the eye has been injured by chemicals. As soon as the patient arrives in the clinic, irrigate their eye. Do not waste time.
Now we need to develop the program for Asia, and this is the aim of this project. Imagine health workers caring for the 4.5 billion population of Asia and 1 billion population of Africa, having access to state-of-the-art video-intense multimedia training to help prevent and treat eye disease. Working together, World Medical Education, the University of the Philippines and the World Health Organization will produce a video library of clinical cases and procedures for health worker training. They will also develop video-intense multimedia training programs for all levels of health workers. To ensure the program is context-specific for the widest possible audience, it will be continually reviewed by experts in eye health from other countries during its development. So many women, their babies and their children still die or suffer lifelong disabilities even after reaching a health facility due to poor care. The World Health Organization estimates that the provision of effective care for all women and babies at the time of birth in facilities could prevent an estimated 113,000 maternal deaths, 531,000 stillbirths, and 1.3 million deaths of babies in their first month of life. It is universally acknowledged that poor education of health workers in resource-poor countries is a huge barrier to preventing this, and a global solution is required. We will work with leading midwives, nurses, doctors and obstetricians to develop state-of-the-art, open-access video-intense multimedia training in newborn and maternal health. Again, imagine the health workers caring for the 4.5 billion population of Asia and the 1 billion population of Africa, having access to state-of-the-art training in the essential interventions that have been proven to save the lives of mothers and babies. With full support, this project can be completed within 3 years. Working together, we can transform the education of health workers worldwide, benefiting millions of children, adults, families, and communities. This is achievable, and with support, a huge amount can be achieved within 5 years. Let's do it now.